our bodies have a complex network of blood vessels, much like a network of rivers and streams. Arteries, the fast-flowing rivers, carry oxygen-rich blood away from the heart to the body's tissues. Veins, on the other hand, are like the slower, wider rivers, collecting deoxygenated blood and returning it to the heart. This return journey is crucial for the heart to keep pumping and the body to function properly. This intricate system of veins is essential for maintaining a healthy circulation. Just like a well-maintained network of rivers ensures smooth water flow, a healthy venous system ensures efficient blood flow back to the heart. Two major players in this system are the superior vena cava and the inferior vena cava. Think of them as the two main tributaries that collect blood from the upper and lower halves of the body, respectively, before delivering it back to the heart's right atrium. The superior vena cava is a large, short vein located in the upper chest. It's responsible for draining deoxygenated blood from the head, neck, arms, and upper chest. The superior vena cava is formed by the union of two major veins, the left and right brachiocephalic veins, behind the lower part of the breastbone. Each brachiocephalic vein in turn is formed by the joining of the internal jugular vein, which drains the brain and deeper structures of the head and neck, and the subclavian vein which drains the arms and shoulders. An important tributary of the superior vena cava is the azygos vein. It ascends in the chest and drains blood from the posterior thoracic wall and can sometimes provide an alternate pathway for blood return if the superior vena cava is blocked. Obstruction of the superior vena cava, known as superior vena cava syndrome, is a serious condition. This blockage, often caused by a tumor pressing on the vein, leads to a buildup of blood in the veins of the head, neck, and arms, causing swelling, facial puffiness, and even difficulty breathing. Early recognition and treatment are crucial to prevent serious complications. The inferior vena cava is the largest vein in the body, running alongside the abdominal portion of the aorta. It carries deoxygenated blood from the legs, abdomen, and pelvic organs back to the heart. The inferior vena cava is formed by the union of the right and left common iliac veins, which drain the legs and pelvis at the level of the lower back. Remember the tributaries of the inferior vena cava with the mnemonic "I like to rise so high." Iliacs, lumbar veins, testicular or ovarian veins, renal veins, suprarenal veins, and hepatic veins. The gonadal veins, testicular in males and ovarian in females, show slight variation in their drainage. The right gonadal vein drains directly into the inferior vena cava, while the left gonadal vein drains into the left renal vein, which then joins the inferior vena cava. Section 4, Intersystem Anastomosis Backup Pathways. The venous system has built-in backup routes known as anastomoses, which are connections between different veins. These connections provide alternative pathways for blood flow if one route becomes blocked. Understanding these anastomoses is crucial in clinical practice. One important anastomosis is the portosystemic anastomosis, connecting the portal venous system, which drains blood from the digestive organs, to the systemic venous system. Blockage of the portal vein, often seen in liver cirrhosis, can lead to increased pressure in the portosystemic anastomoses, causing the veins to become engorged and dilated. This can result in conditions like esophageal varices, which are dilated veins in the esophagus that can rupture and bleed, leading to life-threatening hemorrhage. Another condition is hemorrhoids, which are swollen veins in the rectum and anus. And finally, caput medusae, which are dilated veins around the umbilicus or belly button. Section 5. Summary and study tips. Mastering the venous map. The venous system, with its intricate network of veins and backup routes, is a marvel of human physiology. Understanding its anatomy is key to diagnosing and treating various vascular conditions. For instance, the superior vena cava, or SVC, drains blood from the head, neck, arms, and upper chest, with major tributaries like the brachiocephalic veins and the azygos vein. Clinically, this is relevant in conditions like superior vena cava syndrome, or SVCS. On the other hand, the inferior vena cava, or IVC, drains blood from the legs, abdomen, and pelvic organs. You can remember its major tributaries with the mnemonic "I like to rise so high," which stands for iliacs, lumbars, testicular or ovarian, renals, suprarenals, and hepatics. This is clinically relevant in conditions like esophageal varices, hemorrhoids, and caput medusae, often due to portal hypertension. Now here are some study tips. First, visualize. Use diagrams and illustrations to understand the spatial relationships between different veins. Second, mnemonics. Use memory aids like "I like to rise so high" to remember the tributaries of the IVC. Third, clinical correlations. Relate anatomical knowledge to clinical conditions like SVC syndrome and portal hypertension. And finally, practice, practice, practice. Regularly review and test your knowledge to reinforce learning. Mastering the venous system takes time and effort, but with these tips and a systematic approach, you can navigate this complex network and build a strong foundation for your medical knowledge.